Well, good morning, everybody. It's been an interesting year with y'all. We've had a long journey together. Today is our big day to talk about the final plan. I'm just happy you're all here. And we're gonna go ahead and get started, and I'll turn it over to Holly.
Great. Thank you, Barry. Hi, everybody. So glad you're here. I'm super excited for today. It's been a full year that we've been working on this. So we're on meeting number 9. This in concept will be our last meeting together, unless something really changes our thinking. But let's go ahead and we'll start with the first slide. And again, if you haven't yet had a chance to change your name, looks like everybody has. Good job. Okay, so I'm going to go through right now the agenda, our purpose, and our progress to date. Then actually, I just found out we're going to make one small change here, which is we will have a motion on the floor to approve the needs assessment report so that then we can go through all the rest of it. So just to let you know, I got some feedback on the procedure that we'd set up. So now I think I know what we're doing. So after we get that on the floor, we're going to then look at the final poll results for the needs and recommendations, vision, values, and goals. And we have a couple of folks who have made some proposed amendments, so we'll hear those and vote on those. And then we're going to move into voting on the needs assessment report with the proposed amendments. So ideally, if people had amendments, we really appreciated those of you who did submit them in advance. It doesn't mean that we couldn't entertain other amendments, but just hopefully we're all clear and able to, we'll just take our time and get it right. You guys have been working really hard for a full year, so I'm thrilled, actually. And then we'll all share thoughts and feelings at the end. Okay, everybody's doing a good job renaming themselves. Next slide. There we go. All right, I thought I'd start with just a reminder of our purpose, which you have achieved with just a lot of grace and patience and commitment. I see a hands up on the conference room. Yeah.
Yes, I received, this is Teresa Sigatalis. I received an email to come to this meeting. I don't know exactly why. This is my first meeting. Would I be considered as a guest or as a staff member, or what is the clarification of why I'm here?
Yeah,
this is
thanks.
Kathy Malka in the council office, and I'd be happy to come in there and talk to you in just a sec.
Okay.
Terrific. Thank you for being here. Okay, so SAC purpose, here we go. These were our core purposes as a group. So to be informed by the subject matter experts on the needs and gaps within the criminal legal system. And I want to do a shout out for so many people in the field who gave their time to help, really spent a lot of time bringing us the best information that they had. So thank you all for that. And then we've also, the SAC has been working in concert with the IPRTF, the Incarceration Prevention Reduction Task Force, to really think about these priorities and for facilities and services. And then we ended up also talking about systems. Our overall effort was intended to result in a report presenting recommendations for county council, basically a community-driven needs assessment, which is what we have been working on with the support of Jennifer Moon, who's she will be here today, our report writer. But she's going to be a few minutes late, and that this work will be the foundation for the November 2023 ballot initiative. But of course, it's larger than that, and intentionally so. So the ballot initiative will just be one part of that. And at the end of today's meeting, we'll be talking about kind of what the implementation plan will look like. So you'll see how that would roll out. So that's, anyway, good job. You guys, you rocked it. Next slide. So again, here was the process that we went through, and we're now here on January 19th for the final needs assessment. Again, in concept, this will be our last meeting, but if we need to make another meeting, we will. And next slide. Okay, so the decision-making process, we went over this, I think, on the very first time we met, but I just wanted to give it a little reminder. And each time that we do a vote, I will pop this back up so that everybody knows where we are. So I'll open up after a motion has been made, we'll open up to just see if there's general discussion. And in some cases, we will move right into the amendments. So there'll be a motion and a second. Kathy, can you go back one slide, pretty please? Great. Discussion, simple majority vote to pass. And if there's unresolved concerns, we'll note them for the record. Is my signal still okay? Yes? Jack, I'm watching you. Yep, okay. So let's first, at this moment, we're going to confirm that we in fact have a quorum. Is that correct, Kathy? We needed 12 members. Do we have at least 12 members here, I believe?
Yes, we have a quorum.
Wonderful. Good job, guys. Yep.
Wait, didn't we raise the number of people required for a quorum to be 51%? Just, didn't we?
You know,
This is
Kristen,
Kathy Halka in the council office.
I remember
just-
that.
Clarify that the resolution indicates 12, but I'm currently counting 20, actually 22, I think, of 38. So we have a good number of members here, and I feel like people are joining as we speak.
good. So it
Okay.
sounds like
I think we talked, I just for the sake of the fact that this is a public meeting with rules and whatnot, I just want to point out that we did openly talk in one of our SAC meetings about the quorum, and it was determined that 12 was the number back. It was left over in the resolution because at the time there were fewer people on the SAC. And then when the number of people raised, it wasn't amended out of 12, the 12 wasn't a quorum, it was never updated to reflect a majority of 51%. Right. And just because this is
oh, absolutely. So
an
Kristen,
important meeting.
Yeah, no, I totally remember what you're talking about.
Okay.
I totally remember that. I think that what I don't remember is how it went through and if it ever got formalized. But I think regardless, we have more than 51% today.
All right.
And I think that's a substantive issue, but yeah, I remember. I remember that.
Right. All right. I just want to keep the integrity of the process.
I really
clear.
appreciate that.
Yeah. All right.
And we're all working together on that, right? Like for those of you who don't know me, my expertise is actually in formal consensus process. So, I've brushed up on my more Robert's rules, but I expect you're all here with me supporting this process. So Atul, you're up. Atul, did you want to say something? I see your hand up.
It's covered. The fact that you recalled it, my hand went down. Thanks.
Okay, sweet. Okay, are we ready? Okay, so Kristen and Atul, you can put your hands down, and I'll just remind you guys if you need to, everybody, because we are voting today, how about if you will practice right now raising your hand? Can everybody raise your hand successfully? Anybody who can't do that, we're gonna help you. Okay, Doug, can you do it? Good job. Erica's gone. Darren, can you do it? Okay, Teresa, how about you? Dan? Okay, I think we got everybody. Good job, everybody. If you didn't, please just shout out when we come to a vote, and we'll make sure you're covered. Okay, so
And
let's
don't
see.
forget to lower your hands when you're done.
Yeah, oh, good. Yay. And I'm so glad that that Satpal is here. Hi, I'm so glad you're here, Commissioner. Council. Okay, let's go. Next slide, please. Let me just see where I am. Okay, let me go through the guidelines for participation once more with feeling. I'm sure you guys all have these memorized. The whole point of coming here together is that we have diverse views. That was the goal, and that all of these views are welcome. We treat each other with respect, even when we disagree. We stay on topic and speak to the point that's especially important today, as always. If the point has been made, you don't need to restate it, or you don't need to repeat what others have said. I track carefully. And if you could please stay in the room, so avoiding your texts or emails, just stay here with us. And just remember too, and you'll notice me throughout the day, throughout our session, just asking if there's anybody who hasn't had a chance to speak yet, because it's a way better meeting when we have as many voices as possible. All right, next slide. Okay, so before I got a heads up here on process. So before we actually do this, we need to have a motion to approve the report. So I'd like to ask Kathy if you could take down the screen for a minute. And I'd like to hear a motion, please, to approve the report.
So I'll move that we approve the report so we can get it on the table.
Great, thank you. And who did the second?
Yes.
Supple, thank you. Okay,
Holly,
Yep.
I'd like, my hand was up and I'd actually like to clear, I appreciate what was said, but I'd like to clarify the motion we're going to make if that's okay. And I
Yes,
don't care who makes it, but I'd like to request a motion to approve the Justice Project Needs Assessment Report to present to County Council. I think it's important for the record that we clarify exactly what the motion is.
So moved by Scott again.
great,
I'll second it again.
great. Thanks for that clarification. And Kathy, did we get that, or Marty, did we get that in the notes? Yeah, terrific, thank you. Okay, so that means we can open the floor to our to the content itself. So let's have the screen back up. And Marty Solomon, my colleague, is going to present back the poll results first for the vision, values, and goals, and then we'll pause for a minute and see if there's any general reflections, and then we'll move on to needs and recommendations, where we have a couple of amendments that were sent in. So Marty, the floor is yours.
Good morning, everybody. I'm going to start with a quick run through of the results of the vision, values, and goals poll, and then we can discuss those. And then I'll move on to present the poll results from the needs and recommendations poll. So there were two that you did. And the main question that was asked in the poll was, how much do you support each statement on a 5-point scale from strongly agree to strongly oppose? Next slide, please. The exact same polls were sent to all the SAC members and all the members of the Incarceration Prevention and Reduction Task Force. And with the vision, values, and goals poll, we had 38 people complete the poll. 32 of those were SAC members, and of those SAC members, 14 were people who served on both the SAC and the IPRTF. So I calculated 2 response rates, and the 14 people who serve on both groups were counted in both response rates. So we had 80% SAC response and 77% IPRTF response. And that's quite good. So now for the results. With the vision statement, you all should have received the results in your meeting packets, and they are posted on the SAC website as well. In order to make the results fit on slides, I will present the combined percentages of people who indicated support or strong support for each statement. So that's what the percentages are that I'm going to present next. So Kathy, next slide, please. The first one is the vision statement, and we had 97% support for the vision statement. That is respondents who support or strongly support this vision statement. All right, let's celebrate that and then move on. We'll go to value statements next. So these are the core principles to guide decision-making and investments of time and resources. And the results are starting on the next slide. So as you can see from the percentages that are on the right, there was very strong support for all of the value statements. These are the first 4, very high. And then the next slide has the remaining 3 value statements, and they were all supported by 95% or more of the SAC and IPRTF. All right. Moving now to the goal statements. So the goal statements are describing what we hope will be accomplished. And they're divided into 3 types. We have systems, services, and facilities. Starting with systems. There are 5 systems goals presented here, and all of them were supported by over 92% of SAC and IPRTF respondents. And the next slide has the services goals. These are the first 3 here. There are 6 services goals, and we have over 92% or higher on the first 3, and then the next 3 are on the next slide. And here we have 86% or higher support. The goal 5 was 86% of respondents. This is the lowest percentage of all the vision, values, and goals rating, but it's still very respectable percentage of support. And moving on now to facilities goals. Here, the percentages of support for the facilities goals are also very high. So I think that this iterative process that we've gone through in developing and refining the vision, values, and goals over the past several months has resulted in statements that you all support. And that's wonderful. And I just want to take a moment here to shout out to Michael and Kristen, Deborah, Heather, Harriet, and Arlene for coming together to make the final round of revisions in response to the feedback that you all provided at the December SAC meeting. And they really, these statements came together, and we have high support as a result. So I'll turn it over to Holly here if we go to the next slide, and we can just see if there's any comments you'd like to make about these.
Yeah, a tool.
So information is obtained by looking at differences in numbers quite often. So although the gap in numbers is small here, because we're looking at the lowest mid-80s to high 90s, what is the difference between things that scored lower and higher, from your opinion?
You're asking for my personal opinion? Or are you asking the group?
Well, I think you spent the most time looking at the data. So, yeah, your best attempt at explaining why something scored lower as opposed to why something scored higher.
Well, we sent out the full results so that you could see the comments that are at the end as well. Like you could see the spread of responses and to each statement. And then at the end of the surveys, there was additional comments that were offered, and that offered a little bit of clarification that some people there provided about why they scored something a specific way or not. Not a huge amount of detail, but that's probably where I would look for more information about that. And I think if I was just to make a general statement about it, I think some of them are wording issues where somebody didn't like a particular word or the way something was phrased, and some of them are more a personal belief that didn't jibe with a specific statement. And but we are moving forward as an entire group. Throughout this whole process, we've said, you don't have to agree with every word. We are looking more at this holistically, and what we are trying to shape the words. We are trying to get them so that we all can, as many as possible, can be in full support of what it says. And that's what we've tried to go for here. And I think we're showing that we're there. The specifics, I think, are it's more individualistic.
Yeah. Thanks, Marty. That was really well described. Satpal, you had your hand up?
Yeah, I just wanted to make a general statement myself. I may not be attending every meeting, but I've been really plugged into this thing for a whole year.
Yeah.
It's a very, very important function for the county government as well. I think one of the things is, and this is my understanding, I'm sharing my personal views, not as a county executive, but as Satpal being a citizen. We have worked very hard on this thing, all this. I congratulate all of you. But we have looked at pre-incarceration, during incarceration, and after incarceration. Never these steps have been taken before in needs assessment study. And the things we want as a SAC and as citizens are fairly needed, very wide, but it's the affordability that can we afford to do all of it at one time, or can we do a phased approach? I think that the differences of people's thoughts and in my view are that what we should really consider as a community, what we can really achieve now in step one, what is the most important thing to do, and then deal with pre and post incarceration. That has not been discussed in that manner, but I think that is a reality of our affordability. Even capacity to do all this will take time. And that's all my comment is. Thank you.
Great. Thank you, Satpal. Okay. Anything else before we move on?
Arlene has her hand up.
Oh, Arlene, go ahead, please.
What I noticed in answer to a tool is that that there's not complete agreement about services following incarceration. That was one of the 89s. And but Satpal makes a good point about why people take their position, possibly being because they don't see it as affordable. I don't personally think that way. I think it's correct for us to go for everything that we want. And then, of course, we understand that it will not turn out to be perfect with everything in it. And we'll deal with the compromises when we have to do that. But as far as funding is concerned, we know that funding can come from many, many sources. And even if it's limited here in our community, there are other places that money can be coming from. So.
Yeah, thank you, Arlene. Appreciate that. Dan, you're up.
Yeah, I just want to respond to the executive's comments. So we are doing several things that we didn't have in 2015 or 2017, including the electronic home monitoring program at both the city level. The city started that, and then the county followed behind a few years later. We so that's there, that's funded. We have the GRACE program that started a few years ago. That is a prevention program. We have the LEAD program that was started out of the prosecutor's office. And by the way, GRACE was a program that was a joint effort between the county, the hospital, the Opportunity Council, and the city, and another group that's no longer around called WAHA. And then we also have coming online the alternate response team that will deal with behavioral health calls that the 911 Watcom Center gets. We have made significant strides in housing that, and we know housing is such an important component for stability for people to not offend or reoffend. The things that we're lacking, in my opinion, are post-incarceration services that we really need to ramp up, so people aren't just put out to the street, and instead have some kind of navigation services. And we also need mental health services within the jail in the incarceral system. So we have plenty of work to do, but I do want to point out that we've done a lot, and that work is very important, and it's funded, and it's very well recognized, not only locally, but by other communities. Thanks.
Thanks, Dan. And you're bringing up good points too about the needs and recommendations that are in the report. And those, we're going to talk about those next. So friends, if your comments are about needs and recommendations, maybe you could just hold them till we shift to that section, which is right around the corner. Yeah. So Bill, go ahead.
Yeah, I just wanted to clarify, the county's been providing electronic home monitoring for over 30 years. So that's something we've expanded through the district court, but it's not something new or in response to this. So thank you.
Yay, thanks for that clarification. Kendra?
Yeah, when for the support and service goals, number 5, for the one that was 86%, I'm reading it off my phone here. People released from jail have immediate access to behavioral health and medical care, housing, employment, and support systems to avoid reincarceration. Didn't we as a group decide that the housing was not a part of that? You know, like break the law, here's a house, as a group. So if that's the case, I think this is inaccurate for that. And that's probably why it's so low, because of the inaccuracy is misleading. And it's, as a group, didn't we agree that it's unattainable for housing to be immediate for someone that's been incarcerated?
Yeah, we did talk about that, and
yeah.
So Bill, if you could lower your hand, Kendra, you can lower yours, and Michael, I'm hoping you might have a reply to that.
Yeah, I do. It's an important thing that I think we need to explain. Otherwise, I think it will be misinterpreted. Yeah, get arrested to get a house. That is not, I think, the message. I think the message is that people deserve access to housing in order to minimize their risk for crime. And you don't deserve it more or less whether you're arrested or not. So I think it really has to do with increasing access to housing support for those who are ready and willing and able to accept that support. Maybe the way it's worded doesn't portray it that way. And if so, I'm sorry, a little bit of wordsmithing, but that's, you know, if this comes across as get arrested, get a house, I wouldn't support it either. That's not how I read it. That's not how I hope we're saying it. So do we need to say it differently, or is it properly clarified in the long form of the document?
Yeah, I remember us working on this too. So yeah, Scott, go ahead.
Yeah, I just, it would be nice, because we have 30 experts in the room, to rank all of these things, if there's 10 suggestions or 20, 1 to 20, so that somehow through this, we get a feel for, oh, everybody agrees we ought to do this one, but this is the last one we ought to do. Because I think our policymakers in the future are going to go, well, great. Everybody says every program is wonderful. We can't afford everything. This group, I think, has the best ability to maybe rank them as well. But it would be a horrible job to go through that ranking for me personally. But I think it would be very helpful for the future. But that's another survey. And personally, I've had enough of these. So.
Thank you, Scott. Yeah. Okay, Cliff, you're up. You might.
Yeah, so I guess one of my concerns that I see is we are continually looking to government to solve all of our problems, and we use the tax dollars, which we think, I guess, are unending, to do this, rather than empower the community outside of the government and without the tax dollars to do some of this stuff. And when I looked at the housing thing, irregardless of how you want to interpret it, I think that in the end, at some point, people are going to say, oh, we need to give these people housing, and they're going to take it from my tax dollars. And that's been my concern with a lot of this.
Thanks, Cliff. Rel?
Yes, just a couple of responses to some of the comments. To what Cliff just said, I think I would hope, and I don't know, maybe there's a way to make language clear, but that if there was some community partner that was able to provide some of these services, that they would. And I think that is somewhat of what's currently happening, that we're not just relying on government to be providing all of these things, but that if there are people in the community that can do these things, that there would be, that funding would be available to them as well. The other response is just reflecting on what Satpal said about just what's realistic. And I think that I think, and also Scott was mentioning about like ranking things, and I think that would be also, yeah, I agree that that'd be really hard, and maybe it would be beneficial. And I also think that that's where we probably would see a lot less agreement than what we've seen in the survey results currently, as far as what people prioritize over other things. So that might be maybe a more accurate kind of reflection of different viewpoints, but I don't know if we would get the same level of consensus, unfortunately.
Yeah, thanks. So I just want to remind folks that we have been down this road already, that we decided not to rank things, that we are going to present a holistic picture, and that the next step is about like finding, when opportunities emerge, all the different ways that those needs can get met or those recommendations can get forwarded. So our job today is to see if we're ready to approve the needs assessment. So I think the question is, do we need to go back and talk more about the housing, or do people understand the concept is that these services will be provided to avoid recidivism, that they're not like, it's not special about getting special treatment. It's about just access, just trying to, I forget the exact language. So do people understand that? Can they work with that? We had still an 83% agreement, I think, with that understanding. But if somebody feels strongly that they need to make an amendment, this would be your moment to make an amendment, and then we'll see where we go with that. Yeah, Kendra?
I really think it needs to be reworded, because even though Michael stated what he wanted to say, it verbally, does not come across that in the writing. It just says, let me bring it back up. It does not imply that, which is misleading, inaccurate, and unattainable, the way that it's stated, saying people released from jail have immediate access to behavioral health and medical care, housing, employment, and support systems to avoid reincarceration. They have immediate access when they're released from jail. They're not saying specific people, they're just saying people, like as a whole, people have access to all of this, but they're not it it needs to be reworded because this is a deal breaker for a lot of people that it seems to be at 86% of our group who is supportive of everything that we have on the list. If 86% of us state that, then there's going to be a huge percentage more for voters about that. So it needs to be reworded that to specifically about the housing aspect, because that's going to be a big deal breaker. So that's.
So do you think it would be acceptable to take out the word immediate?
Yes, absolutely, absolutely. It's something about for those that qualify for it, because there's so many people. I'm just, there's so many people out there that need housing, and the people will read it as this as saying, "Oh my gosh, the whole thing, break the law. Here's a house." Whereas people that are law-abiding citizens that need housing can't get it, and the housing is a huge issue. It's on everywhere, and so because of that, this is the deal breaker right here. So if that's not rewarded, it's going to tank.
I hear what you're saying, Kendra, and I also, just because we understand it, there's other people who will read this, and I really appreciated Arlene making a specific proposal. As just kind of we're testing the waters here. So let's hear from Brell, and then Arlene. I heard at least Kendra nodding that would meet her concern. So I'll invite to see potentially if you'd like to put that amendment on the floor. So Brell, go ahead.
Maybe an additional amendment, because I felt like what Michael said was really clear, and I think that clarity could be reflected in the statement. Something to the effect of that housing is a human right. And we recognize that housing is a human right, and we also recognize that in order to be successful post-incarceration, housing is a big component of that, and therefore we would recommend that blah blah blah, basically what it already says. So acknowledging that housing is important for everyone, including people that are getting released. I'm wondering if that would satisfy or meet your concern, Kendra.
Another possibility. Okay, so this is the moment also, if you're the kind of person who has a really good ear and a good sense of writing down suggestions, this is when you would be doing that work. And then I'm going to call on a couple more people. If you can keep your comments brief, please. Bro, you can take down your hand, and Cliff, you're up. Do you have an amendment that you'd like to suggest? Cliff, can you hear me okay?
I don't really have an amendment, but I just want to, when we look at something as a human right, that's something that government gives and takes away. The Declaration of Independence said we have certain inalienable God-given rights, and I don't think that we can include that people deserve, as someone said, housing as part of that. It's something that we have to work for and earn. Each of us have to be responsible for ourselves, and we're taking away that incentive by doing some of this stuff.
Thank you. So that addition for you didn't actually help. Thanks for clarifying. Kristen, and then Harriet.
It sounds like maybe we're trying to say more that upon release that the people should not be denied these basic needs. And maybe so if we just, instead of saying immediate access and being, a positive statement in that regard, maybe we should turn it into a more negative phrase. It should not be denied, basic rights, such as XYZ. And in terms of the legislation where people lose their, I think a lot of this came out of conversation about how people will lose their some sort of federal funding if they're incarcerated, and then it makes it hard for them when they get out. It's those types of things too that we're concerned about. It'd be like those ancillary punishment legislations and stuff. It's just not about a big handout. So yeah, I agree. We shouldn't be portraying that we think it is just a big handout.
So thank you, Kristen. I'm gonna have ask Kathy to pop up on the screen. And then we're going to see if we can get this right. And we're just remember, everybody, we have a number of amendments to work through. So as much now as we can dial in what a simple solution is, that would be great. So Harriet, you're up, and then David.
So I appreciate people commenting on the immediate. It was something I was having a lot of trouble with as well.
Yeah.
I have a proposal for wording, if you want that in the form of an amendment.
Yes. Yeah, please.
People released from jail have access to behavioral health, medical care, housing, employment, and support systems according to their re-entry programming, re-entry planning, I'm sorry, re-entry planning conducted during their incarceration period or conducted while they were in jail. Something like that.
Or maybe just a little, does this work?
Or just leave just the reentry plan, sure.
Yeah, that's nice, because we also talk about the reentry plan, I remember, in another section. So that lines up.
It's just,
No, this is great. Let's see if we can dial this in. David, you're up.
Trying to balance what I'm hearing in terms of fiscal responsibility and social responsibility from the group. And I have wording. I'm not the most concise person in the world, but I'll do my best. But I thought maybe the wording where Arlene started, I'm sorry, not where it was started. According to their reentry plan where Harriet started, I was thinking prioritized according to the degree to which evidence suggests it reduces recidivism. So it gives us the task, like it looks at it in terms of making sure that this follows the evidence in terms of reducing recidivism. So if we find that something does, we're also being fiscally responsible by having that. Right, isn't it correct? And that's basically to reducing recidivism, or by which it reduces recidivism.
Great. I think we started using, I just want to, I remember us deciding to use the re-incarceration, if that's okay, just to leave that as is. I can't remember the whole details of that, but if that's okay. So here, thank you for adding that in. Michael, you're up.
Yeah, I actually like David's suggestion, so I'm less enthusiastic about my own. But it could be amended to say people released from jail have access to will have the same access to behavioral health, medical care, housing, employment, and support services as other community members. I don't think it captures the whole point, though. It captures one point that's not a special privilege. On the other hand, there is a sense in which a rational prioritization of clients and recipients of services might suggest that some newly released people actually kind of have a priority, which is why I think I like where David's suggestion is going. It suggests a rational prioritization of services. Again, I use ready, willing, and able as my shorthand for who gets services. Resistant, angry, and rejecting people don't get help, not because they don't deserve it in some fundamental human rights sense, but just because they're not going to use it and they won't benefit from it. So anyway, if we wanted to talk about the equality, there's my language, but I'm going to actually say I think I like David's approach better.
Okay, Michael, I'm going to stay with you for a minute. Do you feel like that other piece is really important to reinforce, that it's the same as other community members? So, and Kathy, don't worry, I'm here and I'm backing you up here. You're doing a great job. But Michael, if it was just left as is, do you feel like that's adequate, or do you feel like it's important to add that in? And this is similar to what Kristen mentioned, that sometimes people coming out of jail can be discriminated against receiving services.
If I was talking to a member of the public in an ordinary conversation, I would use my language. If I was making recommendations to people who had to make programs and spend money, I would say it David's way.
Let's, Kathy, let's go ahead and add it back in. David, I'm sorry, Michael, the line would go right after support systems.
Well, I have that they will have the same access and at the end as other community members.
Oh, there it is. Okay, same access as other community members. Whoops. Sorry, Kathy, I'm making it harder. to behavior. So I'm going to read aloud. Gang, if we wordsmith this today to death, we will not make it through our day. So we're going to try. We're not going to allow, as I learned long ago, that the perfect cannot be the enemy of the good. You with me? So if you really can't live with this, I do want to hear from you. Otherwise, we have a long way to go here today, and it's not going to be perfect. It's going to be as best as we can. So here's what it reads right now. People released from jail have the same access as other community members to behavioral health and medical care, housing, employment, and support systems, according to their reentry plan. And then I think we need an and there, and prioritized in accordance with evidence-based approaches to reduce reincarceration. Okay, that's where we're at right now.
Holly, I would strike according to reentry plan, because that assumes everyone will have one, and it creates a bureaucratic requirement. They should still have priority access, even if the plan isn't finalized or doesn't exist.
Right. Whoever offered that, is that okay? I mean, we have the reentry plan, I think, in other places too. So let's cut that and see how it lands. If we can get this a little bit less words, that probably wouldn't hurt. Okay, prioritize in accordance with evidence-based approaches to reduce reincarceration. Okay, I really appreciate everybody. We're trying to put some sideboards around this so people understand the intention behind it, that we may understand, but others may not. So Satpal, you are up.
I think that one of the sideboard, I think we are going in the right direction, but one of the sideboard is we are all assuming it's all community responsibility. The whole underlying thing is that we are supposed to, maybe we are government, maybe we are community, we are supposed to do that. But we need to put some emphasis on that person or persons also, how much willing they are to take advantage of this thing. What are they sacrificing for this thing? Like I have seen these drug trial court graduations and all this. These people go through a year of hard time and do this, and they're showing their commitment that they want to be productive citizens of the community. Now, there are people who have criminal behaviors, and that's why they're in and out, in and out. I mean, we need to differentiate that somehow, the people who are actually reforming themselves and making commitment to do that. That's why I think that the plan we talked about, that their reentry plan, if it's not there, we should make it there, because that's the only filter. Otherwise, we have no filter. We are just saying everybody. So that's what my point is. Thank you.
Yeah, I think your point's well taken. So Satpal, are you saying that you think that putting in the part about their reentry plan is important?
Yes.
Okay, let's put that in. Put it back in then. Great. And I think that the part about that people need to be motivated, they need to be personally accountable, is also in another, it's in the section above. So I think we have emphasized that already. So just to let you know, it hasn't been lost, and clearly that is true. So Perry, you're up.
Thanks, Holly. And I apologize. I'm here a bit late, had conflict in schedule. I did want to bring one thought in regards to the word immediate. My sense is immediate access to behavioral health and medical care are oftentimes essential for an individual that is releasing from incarceration. Understandable, the other parts of the discussion relative to housing, employment, and other support systems, whatever that might be. But oftentimes an individual not having immediate access to behavioral health or possibly primary care could result in them being reincarcerated almost immediately. So I just offered that piece. I'm sort of separating out behavioral health and medical care from housing, employment, and support systems because it is important for individuals to get immediate access to those particular services. Hope I've been clear.
So are you saying, Perry, that the reality is that I mean, in a way, I hear what you're saying, but I'm hesitant to flip this sentence more because I think that that would be true based on prioritize in accordance with evidence-based approaches, kind of captures at the end. Do you see where I'm going?
Absolutely. And the place that I was just saying was that in my mind, and as we sort of originated some of this need was identified by the behavioral health gap analysis team. And it was really the inability for individuals to get behavioral health, substance use disorder, or mental health access and care immediately upon the release, or primary medical care. And then I think possibly housing and employment and support systems got added to that immediate.
I see what you're saying.
And that's where it's like, well, whoa, you can't immediately access all these. I absolutely agree with that. So I just offered that history as part of the discussion.
Appreciate that. Gang, I am, as your facilitator, feeling like we need to call the question now because we are, time is of the essence. Yeah, bro, do you have something here that you cannot live with?
Yeah, I think that the addition of the same as other community members just isn't accurate even currently. I mean, not all community members have access to the GRACE and LEAD programs. There are special programs that exist for different kinds of community members. So yeah, I think the other additions are sufficient personally. I think that is just like currently inaccurate and it wouldn't be true in the future either.
I see your point. So I'm going to suggest we cut that line, even though I understand, Michael, your point. And when you add that to the last point that that Perry just made, so just we're going to go all the way back to Arlene's first recommendation, her first suggestion. We just get rid of the word immediate, and that we kind of like, okay, people released from jail have access to behavioral health and medical care, housing, employment, and support systems according to their reentry plan and prioritized in accordance with evidence-based approaches to reduce incarceration. Jennifer, your hand is up, and I'm about to ask if someone would like to make a motion.
Yeah, I just wanted to mention elsewhere in the report, we use the word timely in several places to describe access, so that might be a way of splitting the difference.
Okay, how about timely? Pop that in. Okay, we gotta hope that we are close. Hey, I will entertain a motion on this amendment. Harriet, you move. I see you're moving.
I move that we accept the language as printed on this page.
Right.
And
as the
I second.
final language.
Thank you. Barry seconds. All those in any further discussion? Sorry. Any further discussion? All right. All those in favor, please raise your hand and we'll do a count. And as soon as we have a count from as best as I can, keep your hand up, everybody, till we have Kathy and Marty shout out the count. You're doing great. Okay, to approve. Great. And are we all there? Okay. And you can put your, oh wait, we're waiting for a count, sorry. Marty and Kathy, do you have a count for approve?
I'm showing 29 hands raised.
29 hands, great. And any opposed? Raise your hand if you're opposed. Okay, brilliant. Atul is opposed. Thank you. One opposed. Okay, I need to scroll down for a sec. Hang on. I've got one person who's a SAC member who hasn't named themselves.
Holly, I didn't put my hand down fast. I was 4. I'm sorry.
May we please do another hand raise for those who are opposed to this motion for clarity?
Yeah, and Rosalie, can you hear me okay? I don't have your name on the list, but I think you're the appointee replacing Daryl for Lummy. Is that, can you give me a thumbs up or let me know that I'm
replacing Chairman Anthony Hilaire for Lummy, yes.
Yeah, terrific. Thank you so much. So glad you're here. Okay, we're going to try this again. Everybody, keep your hands up. All right, there is a motion and a second to approve the statement as written on the screen. Please raise your hand if you are in support of this amendment. and keep it up.
This is Kara Allen, and I guess I don't know how to raise my hand, but I am in support.
Thanks. Okay, Kara is in support. Brooke, I don't see your hand up. Are you in support? Yay or nay?
I'm abstaining from voting.
You're abstaining from voting. Eli?
Who's that?
Eli, are you there? Dave, are you there? Doug, are you there? Kristen, are you there? And Heather, are you there? Kristen's a yes. Hannah, Heather, you're a yes. Thank you. Okay, Doug, are you a yes or a no?
The sheriff has to vote for the sheriff's office. I'm just his designee if he's not there.
Love it. Okay, and Eli? Do I know where you are? Okay. Okay, and with Brooke abstaining, and Kara said yes, I've got her at the bottom. Okay, so do we have a final count?
That would be 30 with Kara added in. Yep, 30 approved. Were you going to call for opposing?
Oh, any opposed? Okay, great. Seeing none, the motion carries, and also with one abstention from Brooke. Thank you. Phew, you guys, we did it. Voting on Zoom. This is super fun. But you guys did great of really listening, as per usual, listening to each other and trying to figure out what's going to work. So well done. Really well done there. Okay, take a deep breath. Here we go. We're going to move on to needs and recommendations. So if we could take this screen down, pop up the needs and recommendations, which is on the PowerPoint slide. I think
Slide 23, please.
Yep. Kathy, that was great. Good job there. And Brel, do you have your hand up still, or do you need to take it down? Great. Thank you, Del. Okay, keep going. Next slide. Here we go. Let's see those poll results.
All right, so we did the same type of poll for the needs and recommendations, with that main question being how much do you support each of the statements on the 5-point scale from strongly agree to strongly oppose. And then, so that was how much do you support each need, and then how much do you support the recommendation for addressing each need. All right, next slide. And we'll look at the responses here. We had 36 people respond to this poll, 31 were SAC members. And again, nearly half of those were people who also serve on the IPRTF. We had a 79% response rate from the SAC and 73% IPRTF response rate. Next one. The needs and recommendations are divided into those same 3 groups: systems, services, and facilities. And again, I've combined those percentages for strongly support and support to come up with the total percentages in the following charts. Those are in the kind of brighter blue in this chart, the brighter blue columns. So needs on the left, recommendations on the right. And really, I put these slides together just to give you a quick way to see the level of support for each need and recommendation. We can look at the specific language for any of these needs and recommendations that you want to discuss after we get through just browsing these results. So one note I just need to make for you about the first 3 recommendations is that we flipped the order of A1 and A3 in the report. And that's what those little notes are on this chart. We decided that the pretrial risk assessment just wasn't the most exciting way to kind of kick off all the recommendations in the report. So that was why that flip was done. We also flipped the recommendation 1 and 2 in what is now A3. So if you are looking at the results that you got in your meeting packet, that is how that's the old order with A1 and A3 flipped, the original way. And what you are looking at now is the new order, and that's how it is in the report. If you're looking at your report packet. So sorry for that confusion, but these are the correct percentages given the new order. All right, and you can see here that they range from a low of 81% support to a high of 94%. And we did receive some proposed amendments to A4, which was one of those with the lower level of support, and we'll talk about that in just a couple minutes. Let's go on to the services needs and recommendations on the next slide. So overall, there was high support for all of the services needs and recommendations, with B1 receiving 100% support for the need, which is increased community mental health and substance use disorder treatment capacity to prevent and reduce incarceration and reincarceration. And there was also 100% support for the first recommendation, which is to support additional positions for mental health and substance use disorder professionals within certified community behavioral health agencies. And then the percentages went on down to a few of them have 83% as the low end on services. Facilities is next. The facilities needs and recommendations had high support for all of them. There were a couple of small wording changes proposed to C1 and C3, which we can discuss. In fact, I'm thinking that, Kathy, go ahead to the next slide. And what I'm thinking is that I should show you now what those proposed amendments are. And then we can just roll right into discussion about them. Kathy, is it possible for me to share screen?
Yes, go ahead.
Okay, thank you. Okay, everybody, you ready? You see where we are? Marty's going to show us what the proposed amendments are. And Marty, give us a little background, if you would, please, on. Yeah, yes, I will. So what I want to show you here, and this was sent out to you yesterday afternoon. So both Harriet and Kristen contacted us with proposed amendments saying that one of the concerns that was raised about A4 is that this recommendation for training programs, for training to address racial inequities or disproportionate incarceration of BIPOC individuals has mixed effectiveness, according to some research. And of course, we want all of these recommendations to be very evidence-based. And there is some question there. So that started a conversation, and we got input from Dr. Alexis Harris at UW, Department of Sociology, weighing in on this as well, and Stephen Gockley weighed in, and between us came up with the following proposed changes in wording and a replacement of recommendation 1. So I'll just go through it in case you didn't get that email yet and didn't look at that email yesterday. So the proposed change to the need is to cut the last part, which is by implementing training programs. So we have addressed the disproportionate incarceration of BIPOC individuals, period. The recommendation about training was changed to conduct analysis of root causes where disproportionality and disparities arise, and develop targeted strategies to measurably improve proportionality of incarcerated BIPOC individuals. The second recommendation was changed by cutting the ending here. So ensure that all county law enforcement employees, jail staff, and staff in all court systems maintain data systems adequate to identify where potential bias and racial disparities may be occurring. And then a third recommendation was added. Include detailed data and analysis regarding racial makeup of incarcerated individuals in a standing system information report that is reviewed no less than quarterly by senior management and made publicly available without identifying information. So those were were proposed changes on A4, and I'm sure Harriet, Kristen, Stephen, et cetera, can speak to those. I'll go on and just say the other two, and then we'll just open it up for discussion as before. So the other two proposed changes were.
Marty, we need to process wise, we need to do these one at a time.
Yep, I got it. So Marty, you're going to just tell us what the other C1 and C3 is, and then I'm going to take motions to amend, and I'm going to call on you guys. So get ready.
Yeah.
Go.
So with C1, the need is a new jail that has, and then we list all these criteria. The addition is proposed here for this fourth bullet. Designed with spaces and equipment to provide incarcerated individuals with common dignity and needed services, and then examples of those services. So with common dignity and is the addition on C1. And then on C3, in the recommendation, this recommendation is about advocating for funding to improve permanent supportive housing with on-site clinical support. And we had advocate for state funding. The suggestion is to add federal and private funding as well, and not limit it to just state. So those were what we put out there as some proposed revisions to these statements, and can go ahead and do those motions and then open it up for discussion.
Wonderful. Okay, Marty, thank you. And so if you would please scroll back up, we're going to take them one at a time. The SAC member who actually initiated this amendment, you remember we were all going to try and send them in. I'm going to call on you to start us up. So Harriet, you were the real voice here on A4. We're going to need to take each of these recommendations one at a time. So if you're ready, Harriet, I would entertain a motion for an edit on the A4 recommendation 1 on the need. Would you like to move?
I so move.
Great. Can I yeah, do I hear a second?
Second.
And that was Brell. Thank you, Brell. Okay. So we have a motion and a second. Then the proposal here is to change it, the need number 1 to say conduct analysis of root causes where disproportionality and disparities arise, and develop targeted strategies to measurably improve proportionality of incarcerated BIPOC individuals. The floor is open for discussion. And Atul, I see your hand, but I think, Brell, did you have, I think you were up first. Did you have? Yeah, go ahead, Brell. Brell, you're up, and then Atul.
Hi, so we're talking about the recommendation or the need. We're talking with so wasn't there, I'm a little confused because I thought earlier I had seen a section that had struck a line that said that.
Oh, like, I think hold on. Did I just screw up?
I think we're talking about the need first. And
yeah, that was
okay.
Okay, Harry, would you
Okay.
remove or something? Just, I think I did the wrong thing. We're on the, need, right?
no.
So. Mhm.
No, I think that was my suggestion on the need.
Yeah.
The need is to address the disproportionate incarceration. If you go on with the rest of the sentence, then you're talking about a solution.
Right.
And I think that that's premature, as I suggested for the actual recommendation.
Okay, so the motion, let's clarify. Harry,
The motion.
Move to change the need as
Yes.
written.
So moved.
And Brel, do you still second that?
Yeah, I do.
Okay, that was my bad. I apologize, you guys. We are on the need. I screwed up. So we had a motion and a second. And now we're opening the floor to discuss this amendment, which is to address the disproportionate incarceration of BIPOC individuals. Straight up. Yeah, Atul, you're up.
I'd like to get a clarification.
Yep.
What is this need in context? Meaning, it's a self-standing need of the needs assessment coming from the Stakeholder Advisory Committee, or is it a subset of a facility request?
This is one of the systems needs, and it's one of 7 systems needs. Does that help?
So there's no conditionality to this need. It's not saying based on a particular facility decision, it's a self-standing need that precedes any facility recommendations.
Right.
That's true.
Yep. Okay. Other comments? Okay, I hear a motion in a second. Okay, no further discussion. Okay, you guys ready to vote? Okay, all those in favor with this proposed amendment to that the need of A4 has been changed to address the disproportionate incarceration of BIPOC individuals, period. Raise your hand if you're in support of the motion or the amendment. See lots of hands here. Good job, everybody. Okay, keep your hand up. Don't take it down yet. Good job.
If you don't know how to raise your hand, say something.
Yeah. So Kara, do you want to vote for in support of this one? Rose or
Yes, please.
in support? Great. Rosalie? Rosalie, are you there? Okay. As soon as I get a count, then we'll ask for any folks in opposition.
Holly, this is Stephen. Before you ask for any nay votes, would you wait for all of us to put our hands down? From the A votes? We didn't do that last time.
Yeah, thanks for that feedback. So everybody keep your hand up until I hear a count from Marty or Kathy. Then I will ask you to put your hands down. And then I will ask for a nay if there's any nay votes. Okay. So right now we're all still keeping our hands up if we are in support of this amendment. Keep your hands up. And Kathy, I'll wait for your number.
It looks like 28, but I think it needs to be fewer because we can't have double votes for some members who are here representing one position. And I also just asked an SAC member to unmute. If that is you and you received a pop-up box, can you please rename yourself so I know who you are, so I can count your vote, please?
Great. Okay. It looks like the conference room is also giving a hands up. I don't know who's in the conference.
Peter.
Oh, that's Peter. Hi, Peter.
I'm counting that as a vote for Peter.
Okay. Yeah, I didn't know who was there. You're so tiny on the screen. Okay.
So I think with
Okay.
Kara as a yay, we're at 28. Is that what you think, Kathy?
Yes, it's definitely a pass, and we'll need to confirm behind the scenes all the votes, which I can do. So I've got the info I need.
Okay, everybody put down your hands. Doing great. I am now going to ask if there are any people who do not support, who oppose the amendment, to raise their hands. So Eric, I think you need to put your hand down because I think you were in support of the amendment. Okay, and I'm not seeing any hands here in opposition. Great, so the motion carries.
Are there any abstentions?
Any abstentions? Thanks. I'll start asking for that consistently then. All right, good job. Okay, Harry, it's back to you. I would invite a motion for the amendment on the first recommendation.
I so move that the first recommendation be changed as is indicated on this document.
Great. Recommendation number 1 amended. All right, do I hear a second?
I can second, but I'm wondering if there's a way to look at recommendation 1 and 2 together on the big screen so we can look at them. Okay, thank you. Cool. Thanks.
I need to kind of make this smaller, I guess. Are you able to see it all?
Yep. So no, make it a tiny bit smaller, at least on my screen at the bottom right, Marty. You can drag that little thing over to the left. I think it'll fix it. Oh, there we go. There we go.
Oh my God. Okay.
Okay, there you go. You got it. Okay, so it's been moved and seconded. Great. Any discussion? Hearing none, I'm going to call for the vote. So if you're in favor with the replacement of recommendation 1, which reads, conduct analysis of root causes where disproportionality and disparities arise and develop targeted strategies to measurably improve proportionality of incarcerated BIPOC individuals, please raise your hand and keep it up until you hear the count. And then from scrolling down here. Hand up, and then Kara, I just need a verbal response from you.
Yep, and I found the hand raise button.
Oh, you're a winner. Great. Rosalie, how about for you? Are you there? Okay. And did the last person who was not? Okay, keep your hands up. You're doing great. As soon as we have the count. Oh, Kara, you did get it. Great.
I think we're at 30.
Kathy, so you got?
Yes.
Okay. All right, everybody put your hands down, please. We're going to get better and better at this. You watch. Okay, your hands are down. Zoop. Everybody, hand down. Put your hand down, and then I'm going to ask if there is any in opposition. Hold on. Not everybody's hands down. Okay, any opposition? Start your hands down, right? Yep, good job. You got it. Okay, everybody just get ready with their little hand buttons. Okay, any opposition to the replacement of the recommendation number 1, as I read earlier? And any abstentions? Hearing none, the motion carries. Okay, we are now on recommendation 2, the amendment, which you can see on your screen. Harriet, I would entertain a motion.
I move that the language on Rec 2 be changed as indicated in the document on the screen.
Great. Can I hear a second?
Second.
Thank you, Barry. All right, the motion to amend has been moved and seconded. The floor is open for discussion. Yeah, bro.
I really liked the part that's X'd out. The last part, it's like just doing analysis without taking action doesn't make sense to me.
Great. Oh, shoot. I forgot another thing. Harriet, you actually get to speak first to the motion. So this is a fun time. You want to tell us your thinking?
Sure. So sorry about my voice. What I was trying to do was pull apart multi-concept recommendations so that it's very clear to the receiver what it is we're saying. Do this, then do this, then do this, and do this. If you lump them all together, if you're talking about being able to measure the extent to which they actually acted on the recommendations or what the results were, you're going to get all bollocksed up about, well, they did a little bit of this and they did a little bit of that, blah, blah, blah. So, so if you break it into chunks that are very discrete, it's much easier for the receiver to identify what it is we're saying they should be doing and to take action accordingly. So this is about maintaining a data system. And we know that the data systems are not, at least this is my understanding, not working in the system, that they're not adequately identifying the racial disparities. And that kind of step number one is to make sure that the data systems are adequate to get you guys the data that you need so that you can take action. So that's Rec 2. If I can go on, even though we're not dealing with it yet, in Rec 3, I said, okay, next step is you've got the data. Now you need to be reporting on it and analyzing it in a way that makes it actionable. And it needs to be looked at on a regular basis and by people who are in a position to take action based on the results. So that's basically what Rec 3 is addressing. Per your comment, we could add a Rec 4, which is to ensure something about action is taken based on the results of routine data analyses that indicate, something, that kind of action. It's just the way I think about this stuff and the way I was trained to look at it doing quality review stuff for county mental health systems, is you just really chunk it so that it's very clear what you're suggesting.
Thank you, Harriet. And I also really appreciate you leaning in here with your expertise. So that was the answer, what the thinking behind it, Brel, and a potential solution to the point you're making. Yes, your hand is up. What's your thought?
I would support that addition. And yeah, in order to support this, I would need that.
Okay.
A fourth recommendation.
Yeah.
Is
Yeah.
Okay.
Either that or keep the part that's stricken, either one.
Okay. Yeah, Cliff. Cliff, did you want to chime in here?
You were unmuted, but now you are muted. There you go. No, now you're muted. Just click it.
Okay, there we go. I don't know if this is the right place to put this, and maybe I'm late in coming to the table on this, but from my perspective, the whole idea or the whole concept of equity is wrong, is racist. What we need to do is make sure that everybody is treated equally, whether it's whoever, rich, poor, whatever, your skin color, nationality. We don't strive to treat people equally. And so consequently, I think to make ourselves feel better, we have included this concept of equity where we try and, I guess I just say, I think it's a racist concept, kind of from the opposite perspective. And that we need to raise these people that aren't really quite equal to us, to give them some kind of a special benefit so that we can feel better and that, I don't know, they can feel better. I just, so I'm opposed, so I'm abstaining from this because I don't think it's a need that needs to be addressed in that way. I think the need is that we strive to treat everybody equally, that all men are created equal, and look at it from that perspective.
Mhm. Yeah, I understand your thinking, Cliff, and I understand too, it's like the end result is there's, I would assume, unity around that, but the way that it's phrased, it maybe wouldn't work for you. I hear that. Yeah. Okay, I could use some help when I have, so Jack or Barry, can you help me out here? So when I have this recommendation 2, and then the request that we would add a 4th recommendation to add in that prompt, to correct the disparities, which was struck. I just need, I need some counsel here on how to do that correctly.
Approve 2, then approve 3, and then if someone wants to propose a 4, then they would do so after 3 is approved.
Okay, I'm going to go ahead then.
Exactly, yeah.
Thank you, guys. Appreciate that. So Cliff, you can put down your hand. Kendra, you've got the floor.
Yeah, real quick. So with the data information about the disparity, by whom is creating, who is making the, I'm going to call it the word complaint, who's going to be making the complaint, and is the complaint credible? If people are being discriminated against, anybody, I don't care what race you are, then what is that actually credible? Or is it a defense mechanism because they're in the criminal system and they don't want to be? So how, and then would be people that are a staff member, would they get fired for something that wasn't credible in a data system that may be creating false narratives? So there's a lot of manipulation and mind games that people often play in the criminal justice system because they broke the law somehow. So how trustworthy are the information? How do you prove that to be credible? Because yes, what Cliff was saying, everyone needs to be treated equal. I don't know where the database is going to be. Is it going to be a biased database? How do you document this? So I don't know how to change that up anyway. It's just personal experiences, which I'm not going to bring about with my friends and what they have stated, which clearly was not a narrative that I would look at it. And so it's like, who's right, who's wrong, where's the database going to go? So this is a slippery slope. That's my concern.
Yeah. So wanting to make sure that the integrity of these systems is true. Okay, so I see Brill's hand, Michael's, and Harriet, and then we're going to call for the vote. So, Brill, go ahead.
I guess, I mean, I understand the thinking of maybe there's some, maybe a cleaner order to add a 4th recommendation. Yeah, I guess that I respect that. I also think that number 2 is just fine the way it is, but, and again, I wouldn't support 2 unless there was a 4, I guess. So maybe I'm just like being difficult here, but yeah, I'm wondering, I guess a question for the person, for Harriet, or the person that wrote this is, does it feel important to you to not have the part that's struck in number 2 and to have it be a number 4? And if so, I'll support it, but I feel like again, it's kind of fine the way it is.
Harriet, do you want to respond?
Sure, actually to both. So Brell, there's a long distance between ensuring that there's an adequate data system and ensuring prompt and effective action to correct disparities. So I think that putting that action item in that one is just kind of, it's in the wrong order, is the best I can say it. And I think it does come after 3.
Thank you.
And
That's is okay.
Yep.
Okay,
And-
Michael, guys, I'm going to try and move this a little more quickly because we're going to run out of time. So Michael.
2 quick comments. Advice to Brell, your best move is to simply abstain on 2 and 3 and then vote yes on 4. I think that would kind of reflect where you are mentally. With regard to Kenda's concern about bias in the data, I think you have to read into the fact that the data themselves, if they're adequate to the task, then they cannot be biased. In other words, if the data is adequate to address and identify bias, then the data itself cannot be itself biased. It's built into the word adequate. Biased data, by definition, is inadequate to the task of identifying bias. It is self-disqualifying. That's how I would view it.
But who is the person making the complaint?
Well, I don't see complaint written anywhere in there.
Well, who's making the disparity? Who's making who's putting the data in? But what has happened? Who has?
Someone has to gather the data. They're not necessarily making a complaint. They're gathering the data, and that data has to be adequate to the task. And the task is to identify genuine bias. If the data can't identify bias, if the data itself is biased, by definition, it's not adequate.
But who
So
is the
it's really
person
talking
putting
about
the
the
data?
data, not about the flawed human beings. There may be flawed human beings there, but
this is demographic data, you guys. This is demographic data. This is not based on individual cases being brought to the fore.
That's
This is like
exactly that's exactly what is the confusion on here. Thank you, Harriet.
Yeah. So that complaints are a whole other process and system.
Thanks so much, Harriet, and thanks for raising that question, Kendra. Okay, we're going to go ahead then. We've had a motion and a second. We're on recommendation 2, and which is currently as the amendment is proposed as ensure that all county law enforcement employees, jail staff, and staff in all court systems maintain data systems adequate to identify where potential bias and racial disparities may be occurring. The motion is now we're going to go ahead and call for the vote. So if you're in favor with this amendment, go ahead and raise your hand and keep it up. 1, 2, 3, 4, 5, 6, 7. 10, 11. Well, this is tricky. See everybody.
There's a counter, so that helps on participants. There's a counter.
Oh, good. Okay,
And
so you have
we're-
enough. Please
We're at
speak.
24. Does anybody need to vote verbally?
Okay, so we're at 24. Go ahead and put your hands down. And then everybody got their hands down. Satpal, go ahead and put your hand down. Arlene, put your hand down if you voted in support. Okay, and then anyone, I'll ask first for opposed, and then I'll ask for abstention. So opposed, we have 1. Thank you, Darlene. You can put your hand down. And abstentions. And we have 1, 2, 3. Is that it? 3 abstentions. Thank you very much. All right, the motion carries. Good job. We're now on to recommendation number 3. And go ahead. I would entertain a motion. Harriet, from you.
I move that we accept the language that is for, I move that we add a recommendation 3 using the language that is displayed on this page.
Beautiful. Great. Would someone like to second the motion?
I'll second, Perry Murray.
Thank you, Perry. All right. The motion has been made and seconded. Harriet, would you like to, you kind of explained it already, but anything you'd like to add here about your thinking?
We had talked a lot about dashboards, et cetera, data dashboards. So this is kind of part and parcel of that, and it would possibly be one element of a grander data dashboard, but that these data need to be looked at regularly and analyzed for discrepancies in proportionality, et cetera. According to standards, oh, I could go on, never mind. Need to, yeah, just need to be looked at regularly so that action can be taken.
Yeah, here. Okay, great. The floor is open for discussion. Yeah, Harriet started off. So anything else? Okay, we're going to take the vote then. And the language here on recommendation 3 is to include detailed data and analysis regarding racial makeup of incarcerated individuals in a standing system information report that is reviewed no less than quarterly by senior management and made publicly available without identifying information. Raise your hand, please. See if we can get that. Everybody, a count on that. Please raise your hand and keep your hand up.
We're at 24. Anybody need to, so that makes 25. Anybody need to say anything? Say a vote. 26.
Okay, we have 26 in support. Everybody can put down your hand. You just voted in support of the motion, of the amended motion to amend. All right, and then we'll go ahead and see a show of hands for anyone who is in opposition to the amendment as stated in recommendation 3. Okay, and seeing none, any abstentions on recommendation 3 as amended? One abstention. Great. Oh, 2 abstentions, 3 abstentions. Anybody else? 3 people abstaining. Okay. The motion carries. Thank you. Brel, did you want to make a motion regarding the other one you spoke to earlier?
Yeah, I'd like to make, I'm not a great wordsmith, but I'd like to make a motion to have a recommendation 4 that includes the what was struck from recommendation 2. It is, do I need to put it into like words? Or
I think it would be then on the screen, it would be take prompt effective actions to correct disparities when they are identified would be the motion.
Wonderful.
Yep. Thank you. Got it. Great. Okay. I see a motion on the floor for a recommendation number. A motion is on the floor for a recommendation number 4 on this same need. Do I hear a second?
I second.
Great. I hear a second from Stephen. All right. Brel, I think you've explained it really well already. So I'm just going to open the floor for general discussion. And start your hands up. So I don't know if it's just up from the last vote or if you. Okay, great. Any further discussion? Okay, let's take our vote. So all in favor of this addition of recommendation 4, where we've retained it, but we've put it down now into its own recommendation. Could I see a show of hands, please, if you're in support of that proposed amendment? Yeah, put your hand up and keep it up, please.
We're at 26.
We're at 26. Wonderful. Thank you, everybody. Go ahead and put your hands down. As soon as your hands are down, I'll ask hands downs for Scott and Eli, I think. Great. All right. Any in opposition to proposed the amendment number 4, recommendation 4? Great. And any abstentions? Eli, Kendra, and Cliff, and Bill. 4 abstentions. Is that it? Great. And 4 people abstain. The motion carries. Good job, everybody. Okay. Whew. So I'm noticing the time. We still have to do 2 more amendments, and then we have to vote on the whole needs assessment. And we still need to talk about the implementation plan. So I'm going to get everybody your head into that. We may need to run over a little bit of time, but I just like to still encourage you to be as focused as you can. RB, did you have, I see your hand up. I'm not sure if it was a holdover or if you have something to say.
Actually, I do have, I'd like to add one amendment to the recommendation 1 on A3. I can do that now, or I can come back to it.
Why don't you come back to it? Thank you. I'm going to make a note on that. Michael?
I have a recommended amendment I'd like to make at a later point under facilities. Just wanted you to keep that in mind with regard to time.
Okay, facilities on the needs and recommendations section.
Yeah.
Got it. So A3, and then Heather, I see your hand up.
I have a more general question that if it's more appropriate to wait to talk about it later, but I'd like to just throw it out there now, if that's okay. And that is, what is the commitment to these recommendations from the key decision makers moving forward, regardless of anything on the ballot? Because these are some really good, solid recommendations and work that should be done no matter what, I think. And so I'd love to just get clarification on that at some point.
Yeah.
Holly, I can do that under the next steps portion. I can talk a little bit about that.
Thank you, Barry. Great. Okay, so we are on to a proposed revision on the need A3 and
C1,
so,
right?
C1. I'm sorry. Now I can see it. Thank you for scrolling up. So, Kristen, I would entertain a motion.
All right, I move to amend to add with common dignity into that phrase there.
Great. A second. Is anybody interested in offering a second? Michael, I see your hand up, but I'm not sure if you're seconding or if you just need to say something else.
Sorry. My amendment has to do with this section, but it doesn't have to do with common dignity.
I guess I could explain a little bit more if there's going to be a problem. I just thought that when we were
Hold on 1 second, Kristen, because we don't actually open it for discussion or explanation until we have a second.
Oh, okay.
So I just need to find out if somebody is going to second this motion. Otherwise, we're going to keep on moving.
I'll second it.
Thank you, Atul. Okay, go ahead, Kristen, you're up.
When we were working on our core values, one of them was to include common dignity or humanity into the process. It was just a comment. It was a mood that we had when we were working on our values. And so I was trying to find a place to fit it in here into the design section. And so I added those words. If they're superfluous, that's okay. But I just thought that it would be a good to have as a guiding principle here.
Thank you very much. Okay, the floor is open for any additional discussion. So Jack and Erica.
Just a quick comment. I'm not crazy about the phrase common dignity. Would you accept dignity or human dignity? I think it might be more appropriate.
Sure. Just, yeah, it's okay with me. I just thought that some sort of injection into this
thank you, Kristen. So individuals with and needed services. Thanks, Jack. Anybody else have more discussion they'd like to offer here? Okay, I'm going to go ahead. Oh yeah, Stephen, did you have another comment?
I think procedurally a tool would need to accede to that change that Jack proposed.
I do.
Got it. Thank you. Thanks, Atul. Okay, further discussion? Let's go ahead and take the vote then on the change where on the 1, 2, 3, 4th bullet point down, the language would now read designed with spaces and equipment to provide incarcerated individuals with dignity and needed service, da, da, da. So the addition of with dignity. Please raise your hand if you're in support of this proposal. Okay, so a couple of you have not yet raised your hands. So again, you're voting to whether or not you approve this proposal. Lisa, Brooke, who else is on here? Cara, Brell. Well, thank you, Cliff. Just making sure you guys are all awake. Okay, as soon as you
no, this is Maya. I can't vote because Stark and I share a vote and he's voting. So that's why I'm not participating. I am.
Oh,
thank you.
Thank you, Lisa. I'll stop calling you out then. It's hard to track y'all. Okay.
27.
27. Great. Everybody put down your hands. Yeah, righty. All right. Anybody in opposed to this proposed amendment? Everybody, I'm sorry, I'm going to wait for a sec till you put down your hand. Dan, I think you were in favor, or are you opposed? Arlene, were you in favor or opposed? Put down your hand. Eli, are you in favor or opposed? Okay, that means you're in favor. Okay, now I'm asking, and you guys are doing so great. Is anyone opposed to this proposed revision as moved and seconded? Seeing none. Any abstentions? Okay, Brell and Brooke are abstaining. 3. And Cliff, 3 abstentions. Excellent. Okay, here we go. We're going to keep moving. I know I heard you that Michael, you have one on here, but because Kristen got hers in by the deadline, I'm going to honor that she got in by the deadline. So C3, Kristen, I would entertain a motion.
Here I asked to have, instead of just limiting it to recommending state funding, to expand the recommendation to include federal and or private funding. And I'm moving to have that added in there. I guess I see the screen here.
I think it's, yeah.
There.
So
I second.
And Stephen is seconded. Kristen, do you want to say anything else on this?
Just why limit ourselves? Why limit the recommendation so much? So
thank you. Great. So the floor, any other discussion on this? Great, hearing none, we're going to go ahead and call for the vote. So if you're in favor of this amendment, please raise your hand. As soon as we get a count, I'll let you know.
Looks like 28.
28. Great. Okay, 28 in favor. Go ahead and put your hands down. Everybody put your hands down if you just voted. Woo, look at you go. Good job. Scott, hand down. Great. Okay, any opposed? All right, any abstentions? And 1, 2 abstentions. Okay, fantastic. Thank you guys. Okay. So Michael, I think there were 2 more recommendations or 2 more proposed amendments that I heard. Who is going? Let's see. I think the first person who spoke was Arby. Did I say your name right? I'm sorry, I don't have you on my screen right this second.
Yes, that's right.
Yeah, go ahead, Arby. Do you have a proposal?
Yes, good morning. My comment is regarding the changes that were made to recommendation 1 of A3, where we define the need to reduce the number of people detained in jail before trial or other case resolution. And the recommendation is to provide a range of pretrial release and monitoring options in lieu of bail. But it was added in parentheses, adhering to court rule CRR 3.21. I was thrilled to see that 94% of SAC members surveyed supported this recommendation, with 58% strongly supporting it and no one opposing it. But I am concerned, however, that the late addition of this qualifying statement adhering to court rule CRR 3.2 unnecessarily dilutes the SAC's recommendation, which is intended to safely reduce the jail population. This qualifying statement seems to imply that Whatcom County needs to be reminded of following court rules should the county choose to implement that particular recommendation. This is also the only recommendation that includes any such qualifying statement. But most importantly, the addition of this qualifying statement creates an unnecessary confusion for the public. I mean, is the SAC recommending other options in lieu of bail? Or are we recommending the specific court rule that pertains to how cash money bail is administered in our state? Cash money bail is a poverty penalty that adversely affects our entire community. Someone's inability to pay bail can result in job loss and homelessness, further destabilizing their life and our community. This is not a partisan issue, or an issue that's unique to Whatcom County, but keep in mind, 64% of our jail population surveyed said that their inability to pay bail resulted in a longer stay. So I respectfully request that the qualifying statement referencing Washington court rules be omitted from the needs assessment report. I mean, let's end cash money bail in Whatcom County. So therefore, I propose an amendment to A3 recommendation 1, removing the qualifying statement referencing Washington court rules. So it would then read, provide a range of pretrial release and monitoring options in lieu of bail. Thank you.
Thank you. So there's a motion to amend recommendation 1 on A3 to remove the statement adhering to court rule CRR 3.2. Do I hear a second?
Second.
All right, thank you. It was seconded. I'll open the floor for discussion. I think you spoke really eloquently, RB, so if you don't mind, I'd just like to see if there's any other discussion from folks. Discussion? I saw a hand flash. Where did it go? Yeah, Barry, go ahead.
Just one question. I'm just wondering where this came from to begin with. Like if did legal weigh in and put this in there for some specific reason? That's Kathy, do you know?
Yeah, or Marty, do you know the?
My memory is that came through conversation with Stephen. Stephen, are you recalling that?
I'm sorry, I don't recall that.
Okay.
But to your knowledge, it was not a requirement that came from legal.
No.
Okay, that was my question.
Great.
If I may speak to this is Stark Follis.
Yep.
You know, I'm not sure what position I take on eliminating that language, but I will point out that Criminal Rule 3.2 has very strong language contained in it that enforces the presumption of release, or is in favor of the presumption of release. It specifically reads, any person other than a person charged with a capital offense shall at the preliminary appearance or reappearance be ordered to be released on personal recognizance pending trial unless, and then it details a number of conditions that the courts fairly routinely apply in first appearances. But the four corners of Criminal Rule 3.2, basically encourages or mandates the release in most cases unless specific conditions are found. It's not just a cash bail rule. It's a rule that is intended to drive home to the bench that people should be released unless they can't be, and to just eliminate any reference to that rule in its entirety, may throw the baby out with the bathwater. So I point that out.
Thanks, Stark. It's coming back to me that it was in the exchange with Maya, you, and then Stephen that we hashed through these initial recommendations.
Why that was important to keep in. Okay.
Yeah.
Thank you, Stark. Thank you, Marty. So Scott, if you could go ahead, please.
Yeah, I just was wondering are these rules recommendations or are these rules law? And if it's law, then we got no say in the matter. But if they're recommendations, then I guess we don't have to. I guess if they're law, whether it states it or not, it has to be followed. and I don't know.
Thank you.
Yeah, that makes sense to me too.
Yeah, thanks, Cliff. Cliff, you're muted.
Okay, can you hear me?
Yeah.
Okay, so, yeah, I just wanted to bring in just a personal experience from having worked in the jail. I'm in favor of getting everybody out that, doesn't need to be there or doesn't want to be there. But I know that there have been people that have intentionally been arrested so that they can get into jail, so they can get a bed, meals, medical services. And they don't want to get out of jail. Or maybe they'll wait until there's a more opportune time. And so, yeah, I just wanted to make you aware of that sometimes, and I've seen where people have been arrested, they've been released, and then immediately gone out and committed another crime because they wanted to be in jail. Just a perception.
Thank you, Cliff. Okay, Harriet.
What about replacing the language with something like, rather than adhering, consistent with the principles of court rule? That'd be an option.
Okay, I see a bunch of hands. So we need to pause here for a moment. It is 3 minutes to noon. Is there anyone who is unable to stay? I'm guessing, honestly, we're a half an hour out because we still haven't looked at the implementation plan. So is there anyone who cannot stay till 12:30 today? So we're seeing if we've got a quorum.
I cannot.
Okay, can you stay another, for those of you who can't stay, could you stay, keep your hand up if you could not even stay 15 minutes? Okay, I would like advice from the chair. Barry, could you please weigh in on?
I was trying to get my stuff turned on. I think there's too many people that can't continue for us to validate this process properly in my view. So
Okay.
I would say maybe it was a good thing we booked the 26th.
Yep.
It might be a shorter meeting. We might be a little more focused since we know where we're drilling down to. But I think that's probably the better option unless anybody else has something that they think is would work better.
Okay. So for those of, here's what I'm going to suggest. For those of you who have additional comments here on the A3 recommendation ones, because I see, so everybody who I just asked, could you stay later? You put your hands down, you're good. We're going to go with the chair's recommendation here. So listen carefully. If you had further comment on A3 recommendation 1, please send Kathy an email with your thinking so that we can kind of figure out what's going to resolve it. RB gave a very nice description of his rationale, so we haven't heard from everyone on that. Also, Michael, you had another proposed amendment regarding the facilities, so if you could get that in writing, that would also be helpful. I think it really does help when we can get stuff in so everyone can consider. So it's now 12 o'clock. So if we could take down the screen here, pop it back up to the schedule, which Kathy, I think was on the, I want to say the 3rd slide. Remember we had all the way up, keep going. We wanted to give ourselves enough space, down one, that in case we weren't able to really honor everybody's input and get a full, really come to a place of closure with this, that we have, hopefully everybody's got it on their schedule still for January 26th. So it's now 12 o'clock. I'm going to turn it over to Barry in a moment. to close us out. I think you guys are awesome. You've done awesome work. And look at how we've like just plugged through with getting so many voices on the table and getting our voting procedures correct. And we will see you here on January 26th and we'll finish this up. So Barry, back to you can, Kathy, take off the screen. We'll see everybody here in the room. Okay, Barry, it's all yours.
Okay, thank you. I did see a couple of hands go up and I think they might have questions on maybe our schedule. So I'd like to call on Deborah and then Sheriff Elfo and then Arlene, but let's please be brief.
I forgot to push my button. I don't have my hand up. Thank you.
Oh, okay.
Thank you.
Arlene?
Is it 10 o'clock?
Yes,
meeting?
same time, same channel.
Okay.
Okay.
Okay, everybody.
Great.
Good work today. Good work exercising your hand up, hand down button. I'm sure you will even be better at it next time. So we'll see you next week. We're adjourned.
Good job, everybody. Thank you. See you next week.
Thank you, Holly.